That dry cough that breaks the silence just when the house is quiet at night. That gasp after climbing a couple of steps, a gasp that wasn't there before. Perhaps you have noticed that your companion no longer greets you at the door with that usual explosive energy, that he prefers to stay in his bed while you look for the leash for the walk. It's easy to think that it's just age getting older, and in many cases it's true, but often these subtle changes are actually your heart's first calls for help. You might think your dog is just tired, but that constant fatigue and nighttime cough could be hiding something much more serious. Hello and welcome to my channel. Today we are going to talk about a crucial topic that often goes unnoticed: heart disease in dogs. Unlike something obvious like a limp, heart problems often develop silently, disguised as ailments that we easily confuse with aging. That is why we are going to tell you the 5 hidden signs of heart disease that every owner should know about. We will help you differentiate between simple fatigue and a true warning sign. And what can you do to protect your best friend's heart? But before we start, a very important notice: this video is an informative guide. It does not replace under any circumstances the diagnosis of a veterinarian. If after this you recognize any of these signs in your dog, my strongest recommendation is that you make an appointment with your trusted veterinarian. Early detection is the most powerful tool you have in your favor. Let's start with the easiest symptom to misunderstand: fatigue. Sure, it's normal for an older dog to sleep more or for a puppy to run out of battery after a day of playing, but the fatigue that comes from the heart is different. We are talking about an intolerance to exercise that is getting worse. Think about this: your dog. What before could you endure a 1-hour walk? Now he spends the 15 minutes panting and looking for a place to lie down. Have you lost interest in your favorite toy or chasing the ball? This type of tiredness is not laziness or joint pain. It's a sign that your body is not getting the oxygen it needs. When the heart loses strength to pump blood, the muscles and organs do not receive adequate fuel. Imagine that your heart is the engine of a car. If the engine starts to fail, the heart loses power and has a hard time going uphill. The same thing happens to your dog. Tasks that were once a piece of cake, like climbing the stairs, are now a gigantic effort. This is a hidden sign because it is installed little by little. One day he gets tired a little earlier, the next week a little more. It's such a gradual change that many owners don't notice until it's very obvious. That's why we ask you to pay close attention. Don't compare your 10-year-old dog to the puppy he was, but compare him to how he was 6 months ago. If you notice that your energy and stamina have clearly and steadily dropped, it's time to pay attention. This is often the first hint that something is wrong with your cardiovascular system. The second sign is very characteristic, but you have to know how to interpret it: the cardiac cough. It is key to learn to distinguish it from other coughs. It's not the occasional throat clearing or cough of a cold. Heart cough has a very particular pattern. It is usually a dry, persistent cough that sounds a bit like you're trying to clear your throat without success. But the most revealing thing is when. It tends to get worse at night or first thing in the morning, just when the dog gets up after lying down for a long time. And why does that happen? Mainly for 2 reasons. First, in many heart problems, the heart enlarges. That larger heart can physically squeeze the airways as the attack hits, making them tight and causing coughing. And second, and this has to do with congestive heart failure, a heart that does not pump well can cause fluid to build up in the lungs, known as pulmonary edema. This liquid irritates the lungs and the body tries to expel it by coughing. It is important to know that not every cough in a dog with heart disease means that fluid has built up. Sometimes cough is due to breathing problems that occur at the same time. Therefore, a cough alone, without other symptoms such as difficulty breathing, usually points more to a primary respiratory problem that needs to be evaluated by a veterinarian. If you hear your dog having this type of cough, especially if you already know he has a heart murmur, don't let it go. A dry, persistent nocturnal cough in a middle-aged or elderly dog is a major red flag pointing toward his heart. This third sign is something that you can measure yourself at home, and that provides invaluable information. We are talking about changes in the way you breathe, specifically an increase in respiratory rate when you are at rest. A healthy dog, when sleeping deeply, should take less than 30 to 35 breaths per minute. Most will be between 15 and 25. A breath is the complete cycle of inhaling and exhaling. To measure it, you just have to observe the movement of your chest or belly while you sleep. Count the number of breaths in 30 seconds and multiply that number by 2. An early sign of heart failure is when that number, at complete rest, begins to rise steadily above 35 or 40. This is called tachypnea. It happens because, not getting enough oxygen with each heartbeat, the body tries to compensate by breathing faster to get more oxygen from the air. This sign can progress to something more serious called dyspnea, which is a clear difficulty breathing. Here, he is not only breathing fast, but it is evident that it takes him great effort. You may breathe with your mouth open without feeling hot, you may see your abdominal muscles contract strongly when you breathe, or you may stretch your neck to try to open your airways. If you see your dog struggling to breathe, or with pale or blue gums, this is no longer a hidden sign, it is an absolute veterinary emergency. Getting into the habit of counting your dog's breaths at rest is one of the best tools you have. Do it once a week. If you notice that the number is increasing and you already have objective data to share with your veterinarian, the heart and behavior are more connected than you imagine. A dog with heart disease may show subtle changes in behavior that we often miss. One of the most typical is restlessness, especially at night. If your dog, who has always slept through the night, suddenly starts pacing around the house, changing places without stopping, getting up and lying down again, it may not be simple anxiety. And be careful because it can also be confused with joint problems, that is pain. Often this behavior is a reflection of their physical discomfort. A dog that has trouble breathing or has fluid in its lungs cannot find a comfortable position to rest. When you lie down, the pressure in your chest and lungs increases and you may feel like you are suffocating, forcing you to get up. Another behavior change is loss of appetite. This may be due to general fatigue or because digesting food also requires good blood flow, something your body is now struggling to maintain. In more advanced stages, fluid can also accumulate in the abdomen, which is called ascites. This causes visible bloating and a feeling of fullness that makes you not want to eat. You may also notice that he becomes more isolated. A dog that is not feeling well usually seeks solitude. If your partner, who was previously your shadow, now prefers to be alone in another room, it may be their way of dealing with the discomfort. Don't take it personally. It is a sign that something physical is not right. These changes are hidden because it is easy to attribute them to age or a bad day. But if you combine them with other symptoms, they begin to form a puzzle that points to a heart problem, and we arrive at the fifth sign. There is nothing subtle about this one. In fact, it is one of the most terrifying experiences for any owner, a faint or collapse, what veterinarians call syncope. Cardiac syncope occurs when the heart briefly fails to pump enough blood with oxygen from the brain. This causes a sudden and very brief loss of consciousness. 1 second your dog is standing, and the next he collapses completely limp and unconscious for a few seconds. Normally they recover very quickly in less than a minute, and although they may seem somewhat disoriented, they immediately return to normal. It is essential to differentiate a syncope from a seizure. During a seizure, the dog usually becomes rigid, moves its legs as if pedaling, and sometimes urinates or defecates. A syncope, on the other hand, is a total loss of muscle tone, a flaccid collapse. Fainting can occur during exercise, during a moment of great excitement, or even after a strong coughing attack. These are times when the body asks for more oxygen and the heart races and cannot cope. I want to be very clear with this. Any episode of collapse or fainting, no matter how short, is a medical emergency that requires immediate attention. Don't wait to see if it happens again. Syncope is a sure sign that heart disease has reached an advanced stage. It is the loudest cry for help your dog's heart can give. We've seen 5 signs, from the quietest whisper like being a little more tired to the most alarming scream like fainting. Recognizing these signs in time is the greatest gift you can give your friend. Many heart diseases have symptom-free phases that can last for years. Discovering them early in a checkup because the veterinarian hears a murmur or because you have noticed these small changes can completely change the prognosis. With proper diagnosis and treatment, which may include medications to help the heart, diuretics to eliminate fluid, or a special diet, many dogs can maintain an excellent quality of life for a long time. The key is not to ignore small changes. Don't assume it's all just age. You are the one who knows your dog best. Trust your instinct. If something tells you that it's not going well, you're probably right. Early detection saves lives and, in the case of the heart, gives precious quality time with our faithful companions. Thank you for staying until the end of this very important video. Taking care of your heart is one of the greatest signs of love you can give it. Now, I would love to hear from you. Have you noticed any of these signs in your dog? What has been your experience? Sharing your story in the comments can help other owners who are going through the same thing feel less alone and act in time. And if you found this content useful, please like and subscribe to the channel so you don't miss any more tips to help you give your best friend a long, healthy, and happy life. See you in the next video.